Welcome back. Today we're joined by Ms. Rani Dronamraju, a licensed clinical social worker with over 27 years of experience. Ms. Dronamraju holds master's degree in social working from the University of Michigan and additional degrees from the University of Windsor and Osmania University. Specializing in cognitive behavioral therapy and other therapeutic techniques, she offers valuable insights into treating eating disorders along OCD, anxiety, and tics. Hi, Ms. Dronamraju. It's great to have you here. Let's explore your transformative approaches to eating disorders.
Hi, how are you, Rakshan? So good to meet you.
It's
And
nice to meet you as
I'm
well.
I'm looking forward to chatting with you about eating disorders and how we can kind of find solutions for those.
Okay. So if it's okay for you, I can just jump right into it.
Please do.
What role does a medical social worker play in like identifying and intervening in cases of eating disorders?
Sure. Initially, a medical social worker or a clinical social worker would be talking to a person, and when they identify that a person is eating too much or eating too less or eating because of an emotional need, or sometimes it may be because of a health need, then the social worker has to intervene and tell the person, hey, you know what? Something's not right here. You have to consult a doctor, you have to consult a therapist. And some of the common eating disorders are like anorexia nervosa, bulimia nervosa, and binge eating disorder. And what happens for many of the signs and symptoms of these diseases are where people sometimes completely avoid eating because they're anxious and they're not able to eat, or they're scared, they're nervous, and sometimes they may eat too much because of that. And sometimes these are because of some of the thoughts. Their thoughts might be, if I eat too much, then I'm going to become fat and people will not like me, or I may not be able to go out. How would people receive me? And sometimes when they are eating too much, it's like a habit that they have created to deal with the trauma of theirs, deal with the sad situation that they have dealt with in the past, or they want to overcome that, so they eat too much. So it's either or of those. And it's usually associated with issues when people feel that I'm not good looking, I'm not handsome. When the self-esteem issues are low, they feel, that I have to, what would people say about me? So I have to either eat a lot to cover up that fear and sadness, or not eat, because if I eat, then people will see me and say, oh my God, I'm eating too much or too less, something like that.
Okay, so I take it that like eating disorders are very like they can be either really one-sided on like one end of the scale or like on the other side of the scale as well. And I also take it that they don't affect like one person specifically. I think it should affect like the group around them. So how do you support patients and families when like an eating disorder is identified?
Very good question, because one of the leading therapy techniques or treatment techniques for eating disorders, it's called family directed therapy. So basically, sometimes unconsciously, there's a reward center in our brain. So unconsciously, when you say, Rani, your hair is ugly, then I might go and quickly start eating, because when I eat, my reward center in the brain is happy because I'm eating. So I'm forgetting the pain related to the comment, right? So what would happen is, then my mother will see me and say, Rani, why are you eating so much? Or why are you not eating? So what happens is, even if people tell me something, whether it's, even if it's negative, we call that reinforcement. So I get reinforced that, okay, my mom is paying attention to me, and so then I will go ahead and eat again. So it becomes, a little bit of what we call a habit, a behavior. Anything that we do over and over again becomes a behavior. So then even my eating becomes a behavior. Does
Okay,
that make
so
sense?
oh sorry.
Yeah.
Okay. So, like because it's very effective to like people around you, I would assume that like it might take more than maybe just like one doctor or like one expert to kind of like get people through like an eating disorder. So like, would you say you ever like collaborate with other healthcare providers in the treatment of eating disorders?
Sure. The way it is that first of all, like before we start any therapy, we ask the person to rule any physical health problems. So they go to the primary care physician to check to see if there are any problems there that a person is dealing with. Like is there any healthcare need? Like suppose I'm having, say, calcium deficiency, then I might want to eat everything that's chalky and things like that. And sometimes it might be that, sometimes I may just, tell myself that, hey, I have to eat something to fulfill some other health problem that I'm dealing with. So it's best to get that ruled out. And as any, mostly like with therapists, one of the important things that we do is called coordination of care. So we always try to talk to the doctor and talk to the family and create a plan so that the plan is like comprehensive and all aspects are taken care of at the same time.
Okay, so would you say that it's like sort of a step-by-step process? So maybe
100%.
like you visit one doctor first and then you receive treatment for it, or like something similar along those lines?
It depends a little. Like what happens is, so for the therapist, what we do is we assist the person. So suppose there's a person who comes to me and talks to me about their eating issues. And then what we do is we try to help them as we go through this. So because sometimes they may not get doctor's appointments right away. So we just talk to them and say, hey, if you are going to the doctor on this day, this is what your doctor will help you with, these are things we can do, these are things we cannot do, just assist them with the process, offer them different methods and tips, choose because if we have some therapy tools that we use to basically identify whether it's any eating disorder or any we call it body dysmorphic disorder, because if I feel my body is too fat, then I might not eat at all. If I feel my body is too thin, I might eat more. Some of those things. So basically, just keeping the person doing different things for their behaviors, so they reduce some of the negative behaviors.
Okay. So, but I think that there's also like a lot of like challenges associated with doing that. You have to be like very careful when you kind of like intervene. So looking at it like broader, what are some challenges you might have faced when intervening in like eating disorder cases, and how do you like overcome them?
There are going to be challenges in every case, in every situation. Some of the things that we have to keep in mind is what the person is able to do. Like, suppose now you're eating, you know, uh, 5 slices of bread every day, right? So then I have to be careful to not tell you to completely stop. I can't say, hey, Dakshin, just stop eating bread, because that's going to be difficult. So we have to create a behavior plan where you slowly discontinue that, slowly bring it to a place where it's normal. Like, eating 2 slices of bread is normal. So something like that. And also coming up with different ways. And why don't you take your plate and sit on the table? Or why don't you, eat with in a set. So having certain guidelines and rules in a person's mind will assist them. And if there are, times when the person feels like, like suppose they say, I gave up eating sugar and I'm feeling dizzy, then basically offer them the available emergency resources. Call your doctor, call the emergency room, just to make sure that, your blood pressure doesn't drop because you suddenly stopped eating sugar or whatever it is. There could be so many different issues related to a person. And because sometimes bulimia and anorexia could cause other problems, sore throat, salivary gland tissue, tooth enamel issues, acid reflux, any of those things. So basically just making sure that they have, know that they should call their doctor or the emergency clinic for whatever they need, right?
Yeah, okay. So, I remember you said earlier that like, one, you kind of have to like take it step by step, and it's like
Yes.
a very delicate process once again. So how do you make sure that like patients with eating disorders have access to like the proper like resources or like the proper like services?
Sure. Basically, we give them a list of resources. We give them, the opportunity to message us if they're stuck in a certain situation. Offer them different options, for, finding out like how to get the support they need with different things. Whether they give them the numbers, and most of the times the members come in prepared, and but if they don't, then we give them a list of available resources that are there in the community.
Oh, okay, okay. So, I know like you said just now that the community can like give a bunch of like a lot of resources that can help people with eating disorders.
Uh-huh.
But I also think that like a big part of eating disorders is like maybe peer pressure or like social factors. So
Yes.
like how do social and maybe like cultural factors as well influence your work with patients? And like how do you sort of address those issues? Like coming back to like more fundamental step.
Sure. And so, basically, you're right about it because our social, cultural, emotional factors all kind of create sometimes a situation that, like, I would say, like a dramatic situation within ourselves to do certain things, and sometimes they call there are some disorders which where people are very selective about the way they eat, and they may have they may have situations related to the phases of, like, being picky eaters, because if I eat rice in my school, then people might laugh at me, or so I'm not going to eat chapati in the school, or no Indian food, no Asian food. Sometimes we create those stories in our mind, and so then that's when we have the list of like restrictive eating, and then what happens is, because I have that restrictive thought in my head, I will not do that. I will, like, when even if my mom gives me a roti or rice, I may not eat it because I have this thought, man, oh my goodness, I should not do it there. And so, for social and cultural factors, when we create the plans, like what happens, like you said, it's a step-by-step process. So, when we're working with people, we create the plan according to what the person is able to. First of all, look at all the factors that the person brings to the table, their personal factors, their emotional factors, their family factors, life factors. Look at all those factors, and then we have to keep in mind that even if, like, it's me and my sister, we both might be completely different in terms of our approach to certain food, though we grew up with the same family and same circumstances. So we have to keep all that in mind in terms of cultural factors. And we have to keep in mind that when we are drawing up the plan, we have to look at what are some of the social factors, what is the family structure, what can the person do, what can the person not do, who they do they have as support systems, do they have the school as a support system, any of those things, and then come up with a way in which they are assisted to reach their goal. So your goal might not be to bring it down to one slice of bread. It may be coming down to 3 slices of bread. So I can't tell you, no, no, you have to come down to one slice of bread. I have to gradually bring you there to that place. So keeping the cultural and social factors in mind is very important, because that will assist us to bring the person to a place where it's easily possible.
Okay, so I noticed you said that like it could be different for like or like the signs or maybe like how each person affected is different. But are there any like common physical or psychological signs and symptoms you look for when assessing a client for a potential like eating disorder?
The signs that we keep in mind is, like, we look at, suppose a person is not telling me about this, right? So then, let's suppose somebody comes in, but if I look at the person's face and their weight is very less, or weight is much more, then I would, or if I talk to them about, generally when I do the assessment, uh, uh, you know and say, hey, what would happen if, what do you do when you're stressed? What do you do when you're anxious? What do you, then tease out those questions that I may have, which may be possible symptoms. And as I ask them these questions, then I can come up to a place where I understand to see what they're dealing with and what is causing them to deal with those different. We call it an assessment process. So when we do the assessment process, we can bottom down to those different solutions for those different things.
Okay. So, and then going back one more time, again, like each person has like a different way to kind of like cope with eating disorders, or they have like a different way they express that.
Yes.
So, do you have any like common therapeutic approaches that you find like the most effective in treating clients with eating disorders?
Sure. One of the things, well, basically, the family-based therapy technique is something that we use a lot because it's very effective. And for the body dysmorphic disorder, what we do is we use exposure and response therapy, where we talk to the people like a habit. We also create a habit reversal technique where we help them to, come up with different ways in which they can look at the problem. And then once, like, for example, you cognitively look, sometimes these behaviors are such that we may not even realize we're doing it. But once we come to a place where, suppose I start documenting that I'm eating 10 slices of bread. So, oh my God, I'm eating 10 slices of bread. Now I have to cut short on it. So it's like that part of it. So it may no, be a behavior that I'm not even aware of at certain times. So that's how we ask them to monitor. So one of the techniques mostly is family-based therapy. So we can even help the family understand what they're going through and how, the family can assist the person and not reassure them and help them to do things from the right perspective.
Okay. So, there's a lot of I take it that there's a lot of like ways you can kind of treat eating disorders.
Yeah.
And well, I guess it's like kind of obvious that maybe they're not 100% effective, or maybe that there's still like a little bit of room where the patient may like relapse. So what like strategies do you use to support clients in maintaining like the recovery and preventing relapse after treatment?
Very good question. Basically, what we do for them is even as they're getting better, because once you're getting better, you come out, you can have the courage and the strength to look at how I made a mistake and I'm not going to make the mistake again, or I how I had that behavior before, and now since I know I had that behavior, I'm going to try not to have the same behavior. Because what happens is we meet, like, once we have any behavior, whether it's anorexia, bulimia, or anxiety or anything, I might go back to doing the same thing because that's my comfort zone. That's, eating those 5 slices of bread is my comfort zone. So what I have to do at that point of time is create a plan. So when I feel like going and eating those 5 slices of bread, maybe I can sit and read a book. Instead of going and eating the 5 slices of bread, maybe I can drink a glass of water. Maybe I can eat an apple, or maybe I can go for a walk, any of those things. And once I cognitively am aware of that, then it becomes easier. But of course, they can always call for an emergency therapy session if they're overwhelmed with any personal issues that they're dealing with or any problems that they're dealing with in life, and go from there.
Okay, so well that's like a pretty comprehensive like overview of like what you can do with eating disorders.
Uh,
And I'm definitely sure that like there's a lot of maybe like special cases, or there's a lot of like outliers in like maybe patients that you have had. So could you talk a little bit about those?
Sure. So sometimes what happens is when people are struggling with OCD or other health issues, or if they've gone through a lot of trauma, say for example, in their life, or if they have any other issues where eating becomes a way of their coping with different things, then what we try to do is see which is the factor that is more difficult to deal with. So, like, we suppose the trauma is very, very intense. We try to address the trauma first. We try to address the OCD first. So we can, bring them to a place where they're calm enough to address these things, right? So, because otherwise they may, suppose somebody is dealing like with the trauma, I cannot tell them, can you please stop uh, eating 5 pieces of bread? They're going to say, no, I cannot stop, because they're eating to fulfill the trauma in their brain, right? So I have to help them to understand how to deal with the trauma first and slowly come to the place where we address the behavior. So that's like one of the outliers that we have to deal with. And if it is, and even if the body dysmorphic disorder, where they feel, okay, I'm so fat, I'm so fat, I'm so fat, then I have to bring them to a place where they're able to be aware that they are not necessarily fat, or they may not be necessarily thin, but it's like they can be happy with the way they are and do different things. Bring them to that place, and then the eating as a behavior can be addressed.
Okay, I understand.
Mm.
But that's all I had for today. Thank you so much for joining my
Thank
podcast
you.
today.
I'm so proud of you. It's
Yeah.
so nice talking to you. And if you have any further questions, don't hesitate to message me and we can talk about it.